name is Susan Kaplik and I work at Cancer Care Manitoba Breast Cancer Centre of Hope. We're a Department of Patient and Family Support Services. Our role is to provide support to you and your family and friends all along your journey with breast cancer. At Breast Cancer Centre of Hope, we know that each person experiencing breast cancer is unique. So we offer information and support in a variety of forms. We want to work with you to find out what will best fit your situation and needs. So far, you've probably been very focused on changes that breast cancer is causing to your body. But you may find there are other changes happening for you at the same time, or you may come across some of these at various parts of the journey. We want you to know that there are things that can be helpful to manage these other changes as well. A diagnosis of cancer can take you out of your ordinary life. There's a loss of predictability, routine, and control. There are some very practical needs that result from geographical changes if you need to travel for surgery or treatment. There may be some economical changes if you need to be off work for a while. Some people report experiencing social changes, change in friendships, change in role within the family, as well as spiritual changes or a shift in faith. So let's talk about some of the programs that many people have found helpful. Peer support is a focused relationship with someone you can talk to about what it is like to live through and beyond a breast cancer diagnosis. Peer support volunteers are specially trained to provide a listening ear and to encourage you on your journey. They provide one-on-one contact, usually by phone, and peer support is voluntary, confidential, and free. Matches are based on what you feel are your needs and priorities, and often include age, diagnosis, type of surgery and treatment, lifestyle, and other special concerns. The closer the match, the better the contact. So we attempt to match you with someone as much like you as we can. To be matched with a peer support volunteer, simply call HOPE. A peer support can share with you what it was like for her. She may be able to answer questions like, how did you tell your kids? What was it like the first time you looked at your incision? And how did your family react? At HOPE, you will also find a resource center that has an extensive lending library of books and DVDs, as well as a wide variety of pamphlets and links to programs and websites. We have resources on every aspect of the breast cancer experience, and that includes surgery, diagnosis, treatment, nutrition, complementary therapies, social and emotional aspects. There are things that are helpful to partners, children, and those interested in providing support to someone affected by breast cancer. Our newsletter is a good way to stay informed about upcoming events, what is new in research and treatment. Women tell us that reading the stories of other people on the journey brings them comfort and reminds them that they are not alone. Our voice is available on our website or can be mailed to your home. Give us a call to be added to the list to receive it. You will receive excellent nursing care all along the journey. Sometimes it's hard to know which nurse to ask about a particular issue, or you need some extra time to better understand your situation, and that's where our Navigator can help. She has extensive nursing experience in breast cancer and keeps up to date on the latest in treatment and research. You can talk to her over the phone or meet with her at our office. You are welcome to bring anyone you would like to include to the meeting. It's a good opportunity to make sure that you have answers to all of your questions. She can ensure that you know your options and are making your decision on balanced information. Our Navigator also coordinates education sessions that you can attend in person or via Manitoba Telehealth. These include a pre-op session for people considering immediate or delayed breast reconstruction and moving forward after breast cancer, to help people transition back to life after treatment is complete. If you're having a mastectomy without reconstruction, you will want to know about the breast prosthesis program. You are entitled to a free prosthesis and bra with no out-of-pocket expense to you. There are just a few things you need to know about accessing the program, so we can help to make sure that you get what you're looking for. Breast Cancer Center of Hope is the perfect place to call if you are looking for a group or activity. We do our best to stay informed about what is available to people with breast cancer. We can also help you link to counselors, social workers, and support groups to help you cope with the emotional impact of cancer. Feeling a certain level of distress regarding cancer is normal. We know that approximately 30% of people with cancer will experience anxiety or depression. Sometimes experiencing these feelings is what we need to become proactive about getting support. If at any time on your journey you are feeling overwhelmed, it's important to get help. You can talk to someone at Cancer Care Manitoba, Patient and Family Support Services, or within your own community. I strongly encourage you to come down to the centre. We are located at 691 Wolseley, across from the Misericordia Hospital in Winnipeg. If you would like to meet with our navigator, it's best to make an appointment before you come, but you don't need an appointment to check out our library and other resources. Here is some advice that women who have completed their breast cancer journey wanted you to know. It's important to accept help, but only when what is being offered will be truly helpful. Allowing the people around you to help makes them feel better as well. You may want to write a list of things you could use, like a casserole for the freezer, or a drive to an appointment, or someone taking your kids to a practice. This way you're able to suggest a task at the time the offer is being made. The needs of your family and friends may need to come second for now, because in the long run you will not be of help to them if you are not well. So be kind to yourself. Remember that lots of people will offer you their opinions of how you should feel and what you should do, but allow yourself permission to do what is right for you. Please remember that there are lots of people that are eager to help with the emotional and practical things that may make this time easier.